So I want to talk about heartburn. If you have that burning sensation in your chest, that feeling of, oh my God, what is that nasty taste? It's probably come from some form of reflux. You'd be surprised some of the culprits of reflux. There certainly is a genetic predisposition, but and it's not only just dietary. Chronic sinusitis can be a real big cause of that. So certainly irrigating your sinuses can be very beneficial. Other things that you might have to think about are pain relievers. If you're taking too much Aleve, Tylenol, anything prescriptive, that will have a tendency to weaken that lower esophageal flap, which is kind of at the bottom of the esophagus and protects the stomach acids from coming up. Wearing too tight jeans, those skinny jeans that are real popular now, too much pressure on the diaphragm, lower abdominal area, and pushes up into the diaphragm, I should say. Believe it or not, when you have those after dinner mints, the mints actually relax the stomach walls, and it's great if you have nausea, but if you have it after a heavy meal, sometimes that will actually cause the stomach lining and the walls around the stomach, particularly the flap, to relax, and that will cause acid to come up. Smoking, of course, is a biggie. Smoking will actually thin the lining along the esophagus and down into the stomach, and chronic gastritis, GERD, all those things will take place. Too much salt, actually, it can also be problematic. So what can you do about it? Well, you could try some chamomile tea, you could try ginger tea, you could try acupuncture. Of course, if any of those things don't work, along with the acupuncture, we have herbs at our office that can be very beneficial for you. Watch your stress levels as well. Make sure you get plenty of rest. All those things can really be helpful in taking care of some of the problems of reflux. A couple of other things you might try doing is licorice, little licorice tea. Now, if you have kidney problems, you don't want to do too much licorice because that can also impact the kidneys as well. But if you're having heartburn and you can't control it yourself more than twice a week, then you need to get in and see somebody. Certainly there are over-the-counter prescriptions like Prevacid, things like that, Tums, but make sure you add back in calcium and vitamin D because antacids have a tendency to block calcium uptake and vitamin D uptake. Keep your meals small, keep them simple, stay away from too much refined foods, spicy foods, alcohol, caffeine, always the fun stuff, chocolate, those can all exacerbate it. So hopefully that gives you a tip on what to do with heartburn, and if not, give us a call at the office, we'll take care of it. Bye-bye.